Mr. President, shortly we're going to have an opportunity to vote on the Opioid Crisis Response Act of 2018, which I strongly support. But I want to share with my colleagues a roundtable discussion I held in Baltimore just a few hours ago. I met in an area in Cherry Hill and met with leading experts in regards to the opioid crisis. We had the leadership from Baltimore City, Baltimore County, Anne Arundel County, representatives from the state, and a lot of different other organizations. It started with Dr. Jason Clutter, who's the president of Baymark, giving us a tour of the new facility that he opened up in Cherry Hill. This is a wonderful new facility for opioid addiction. It uses the use of medicines in order to control a person's addiction, and it is the state-of-the-art facility. It was just opened last month or 2 months ago, so it's a brand new facility. And I asked Dr. Clutter exactly how he was able to do this, and the first thing he mentioned to me was the importance of the Affordable Care Act, because of the expansion of Medicaid and the coverage for addiction and the coverage of essential health benefits within the Affordable Care Act. The clinic can get a lot more reimbursement for the people who use the facilities, giving them the wherewithal to be able to construct a new facility in the community, giving access to care for those who have addiction. We then heard from Jose Rodriguez, who's the Baltimore City Health Department's Director of Opioid Overdose Prevention, and he told us about a lot of the innovative programs that we are looking at in Baltimore in order to provide treatment to opioid-addicted individuals. And one of the innovations that Mayor Pugh of Baltimore wants to do is known as a stabilization center. Now, a stabilization center would be 24/7, which is critically important. People that are stressed normally are not during normal business hours. And it's important to have availability in the inconvenient hours of the early morning. And an emergency room provides that access. But the problem is that emergency rooms, many are not capable of handling people with OD'd. And that individual can become very disruptive within the emergency room setting, making it difficult for the hospital to provide adequate care for the other patients. So the mayor of Baltimore wants to establish a stabilization center, which would be 24/7 and available to handle people who have drug problems when they need it, and provide the necessary services to not only save their life, but to put them on a track to deal with their addiction needs. We're very proud of the leadership in Baltimore City to move forward on this, and I wanted to share that with my colleagues, some of the innovative programs that are being suggested. Linda Bryan is the Baltimore County program manager for recovery-oriented system of care. She was telling us about a program in Baltimore County where they use peer coaches. These are a peer support system, people who have gone through the addiction recovery process. They train them under this program, help them to go out and coach those who are suffering from addiction so they not only get in treatment, but they stay in treatment and they have a road to recovery. It's an innovative program that is working well in Baltimore County. We then heard from Jen Corbin, who is the program director for the Anne Arundel County Crisis Response Team. Here, Mr. President, we have an innovative program known as Safe Stations. And let me just explain this. This is 24/7 also. I already told you the need for 24/7 programs. What the leadership in Anne Arundel County, and this is a county that borders Baltimore and borders Annapolis. Annapolis is part of Anne Arundel County. So it's an urban area, but it has some rural aspects to it. They allow every one of their fire stations, every single one in their county, to be accessible 24/7 for an individual who's stressed and needs help in regards to their drug problems. Now, when they set this program up, which is less than a year ago, they were expecting to get about 5 visits a week. They're getting 5 to 10 visits a day. People are coming in to get rid of their drug paraphernalia, no questions asked, they'll take it there. They're getting in there to access system as to how they can deal with their drug addiction problems. They're seeking care. They're coming in there when they're stressed, and they are getting care. The first responders will provide immediate help, and they have the availability of county services to get people into treatment 24/7. It is working. It's working so well that we have people from other counties that are referring their people to go to Anne Arundel County to go to the fire station house. And just this past week, one of the private insurers told one of their insured, why don't you go to the Anne Arundel County fire station in order to get your help? We need to expand these types of programs. The fire chief told me one other thing which was very interesting. Theft crime in Anne Arundel County since they started this program is down 13%. Theft crime, of course, as we all know, feeds a habit. A lot of it feeds habits. And it's showing a paying off to the community in reducing crime. I mentioned today's roundtable. I've had about a dozen in Maryland throughout the entire state, from the eastern shore, the western Maryland, to the Washington suburbs, the Baltimore suburbs, southern Maryland, the northern counties. And there's a common theme here. The common theme is there's no simple answer to the opioid crisis, that it involves not only a health issue, and we need to have services under our health, but we also need to recognize it deals with transportation. It's a social problem, deals with how the courts handle these issues. It's multiple disciplines that are involved in dealing with the opioid epidemic. And that's why I'm so pleased that we're going to have a chance to vote on the Opioid Crisis Response Act of 2018. We all know that despite our great efforts here, and we've provided billions of dollars of additional federal support for these programs, that the opioid crisis is still on the rise. The number of OD deaths are still increasing in many parts of the country. Every community is experiencing challenges with the opioid crisis. So it is appropriate that we are taking comprehensive action to deal with this problem. The Opioid Crisis Response Act of 2018 reauthorizes and improves the 21st Century Cures Act. Governor Hogan, the governor of Maryland, has strongly urged us to pass this section. In FY17, Maryland received $20 million under the Cures Act. And these modifications will help states like Maryland even do more. It's a true federal partnership with our state and local governments to deal with this crisis by providing greater base support for opioid problems. Secondly, this bill provides comprehensive opioid recovery centers under SAMHSA. Why is this important? This allows for locals to apply for federal grants for innovative new programs. I mentioned the stabilization program in Baltimore City. There's also one on the Upper Shore. Stabilization, there's no direct funding for stabilization centers because it's not a hospital and it doesn't fit into the normal reimbursements. This program that's included in the Opioid Crisis Response Act will allow grants to move forward on these innovative programs such as the one in Baltimore City. The legislation provides for us dealing with peer support, an area that I have championed on the Finance Committee and have talked frequently on this floor about the importance of peer support programs. This legislation will help provide technical assistance in order to provide peer support, but also ask the GAO to take a look at the Medicaid reimbursements to see whether we can have a more comprehensive way to deal with peer support reimbursement. It expands telehealth, an area that I've been directly involved with. I'm happy to hear that. That's an important part of dealing with the opioid crisis. It deals with a new area that we haven't really dealt with before, and that's housing. As I said, the problem of opioid addiction is not just health, it's also housing. And this legislation will provide a way in which we can help the homeless and deal with the housing issues in order to make people less vulnerable to being left out of the opioid recovery. It does deal with the underlying causes with research and development and non-addictive painkillers to get CDC grants. and to look at mechanisms to control prescription drugs. And it does deal with the killer effect that we have in fentanyl. Fentanyl, as you all know, is a synthetic drug that's primarily produced in China, but there's other sources that come into this country and are mixed with heroin, causing, in many cases, instant death. This legislation will provide a way in which customs will have greater enforcement to keep fentanyl out of the United States, and will provide detection for first responders so they can protect themselves. Because they go on a scene, there may be fentanyl there, they don't know it, they can become afflicted by this synthetic drug. All this is good news. Madam President, I've only stressed on a lot of the provisions that are in this bill. It's a comprehensive bill. It's bipartisan. It represents the work of several of our committees, including the Senate Finance Committee, which I proudly serve on. I urge my colleagues to support this legislation, and let's increase the federal government's role and partnership to deal with this crisis in all parts of America. With that, Madam President, I will yield the floor.